The story of the contraceptive pill is one of both triumph and controversy, a tale that began in the mid-20th century with the promise of freedom, autonomy, and control over reproductive health. But as decades have passed, a deeper narrative has emerged, one that speaks not only to medical innovation but also to the complex relationship between synthetic hormones and the human body. At the heart of this story lies a powerful shift in how women's bodies are understood, treated, and even managed by modern medicine. In 1957, a new chapter was written in the history of medicine when the first oral contraceptive became available. It was hailed as a revolutionary breakthrough, a scientific marvel that gave women the ability to separate sex from reproduction. The 1960s followed as a time of social transformation, often referred to as the sexual revolution. Women were no longer bound by the fear of unintended pregnancy, and for many, this meant newfound independence in personal and professional life. But behind the scenes, within the laboratories of pharmaceutical companies, a different kind of transformation was taking place, one that would quietly reshape the hormonal landscape of millions of women around the world. The contraceptive pill, while seemingly simple in its purpose, is anything but straightforward in its composition and effects. Its foundation lies in the extraction of a plant compound known as diasgenin, found in the Mexican wild yam. This compound, though natural in origin, is far from harmless in its journey toward becoming the active ingredients in the pill. In a laboratory setting, diasgenin is chemically altered through a series of complex reactions to create synthetic versions of estrogen and progesterone, two hormones that play critical roles in the female reproductive system. Estrogen and progesterone are naturally produced by the ovaries and work in harmony to regulate the menstrual cycle, support fertility, and maintain overall hormonal balance. However, the synthetic versions used in the pill differ significantly from their natural counterparts. These lab-made hormones are designed not just to mimic the body's own hormones but to dominate them. They do so by suppressing ovulation and preventing the release of an egg, effectively tricking the body into thinking it is pregnant. While this may seem like a clever workaround, the long-term consequences of this hormonal manipulation are profound and, in some cases, alarming. One of the most significant issues arising from the use of synthetic hormones is what is now commonly referred to as estrogen dominance. In a healthy hormonal environment, estrogen and progesterone exist in a delicate balance, each hormone keeping the other in check. Estrogen, often described as the fire in the body, is responsible for growth and stimulation, while progesterone acts more like water, providing balance and stability. When progesterone levels are suppressed, often due to the suppression of ovulation caused by the pill, estrogen becomes unchecked. This imbalance can lead to a cascade of symptoms and conditions that affect not just reproductive health but overall well-being. Estrogen dominance manifests in various ways, from mood swings and weight gain to more severe issues like fibroids, ovarian cysts, and endometriosis. Endometriosis, in particular, has become increasingly prevalent in recent decades, with estimates suggesting that over 10 million women in the United States alone suffer from this condition. What makes this statistic even more striking is the fact that in the early 20th century, there were barely 100 reported cases worldwide. The rise of the contraceptive pill coincides almost exactly with this dramatic increase, raising important questions about the role of synthetic hormones in shaping these trends. Endometriosis is a condition where tissue similar to the lining of the uterus grows outside the womb, causing inflammation, pain, and scarring. For many women, it results in excruciating menstrual cramps, chronic pelvic pain, and infertility. Despite being a relatively common condition, it is often misdiagnosed or dismissed as normal period pain. Some doctors reassure patients that the discomfort will eventually subside with menopause, offering little more than temporary relief through painkillers or surgery. But this approach fails to address the root cause, the hormonal imbalance that allows the condition to develop and persist. The problem with treating symptoms without addressing underlying causes is that it sets the stage for recurring issues. Just as one might try to put out a fire with water without turning off the gas supply, simply managing pain without correcting hormonal imbalances leaves the door open for future flare-ups. This is particularly concerning in light of the growing number of women who find themselves on a never-ending cycle of treatments and surgeries, only to face the same challenges again and again. Another troubling consequence of estrogen dominance is the increased risk of certain cancers, including breast and uterine cancer. Estrogen is a powerful cell proliferator, meaning it encourages the growth of cells throughout the body. When unopposed by progesterone, which has a balancing effect, this can lead to abnormal cell growth and the formation of tumors. Studies have shown that long-term use of the contraceptive pill, especially older formulations with higher doses of synthetic estrogen, is associated with a slightly increased risk of breast cancer. However, the picture is not entirely clear-cut, as newer low-dose pills appear to carry fewer risks and may even reduce the risk of ovarian and endometrial cancers. Despite these findings, the conversation around the pill and its long-term effects remains polarized. On one side are those who celebrate it as a tool of empowerment and reproductive choice. On the other side are those who raise concerns about its impact on hormonal health and advocate for alternative approaches. This divide reflects a broader tension in modern medicine between conventional treatment models and holistic, patient-centered care. At the center of this debate is the question of whether the benefits of the pill outweigh its potential risks. For many women, the answer is yes. The ability to plan pregnancies, manage heavy periods, and reduce acne has made the pill a valuable part of their lives. However, for others, the toll of hormonal imbalances and related health issues has led to a re-evaluation of their options. This has sparked a growing interest in bioidentical hormones, hormones that are structurally identical to those produced by the human body and therefore interact with the body in a more natural way. Bioidentical hormones represent a departure from the traditional approach to hormone therapy, which has long relied on synthetic compounds. Unlike their synthetic counterparts, bioidentical hormones are derived from plant sources and are customized to match an individual's specific hormonal needs. Proponents argue that this personalized approach offers a safer and more effective alternative to the standard pill, particularly for women who experience adverse effects or struggle with hormonal imbalances. The rise of bioidentical hormones has been accompanied by a broader movement toward integrative and functional medicine, which emphasizes the importance of treating the whole person rather than just isolated symptoms. This approach recognizes that hormonal health is influenced by a wide range of factors, including diet, stress, sleep, and environmental exposures. By addressing these underlying contributors, it is possible to restore balance and promote long-term wellness. But even as awareness of these alternatives grows, the mainstream medical community remains divided. Some experts caution against the use of bioidentical hormones due to a lack of large-scale clinical trials and regulatory oversight. Others argue that the focus should remain on improving the safety and efficacy of existing hormonal therapies rather than pursuing unproven alternatives. This ongoing debate highlights the need for more research and open dialogue about the best ways to support women's health. Looking beyond the pill itself, it is also worth considering the broader cultural and societal context in which it exists. The introduction of the contraceptive pill marked a turning point in the history of gender relations, giving women unprecedented control over their reproductive choices. It played a crucial role in the feminist movement of the 1960s and 1970s, helping to break down barriers and challenge traditional roles. Yet, as with any powerful tool, it also came with unintended consequences. One of the most significant of these is the normalization of hormonal intervention as a means of managing women's health. From birth control to hormone replacement therapy, the use of synthetic hormones has become deeply embedded in modern medical practice. While these interventions can offer real benefits, they also carry risks that are often overlooked or minimized. The emphasis on quick fixes and symptom management can sometimes overshadow the importance of understanding and respecting the body's natural rhythms. This brings us back to the core issue, the need for a more nuanced and comprehensive approach to women's health. Rather than relying solely on pharmaceutical solutions, we must consider the full spectrum of factors that influence hormonal balance. This includes not only medical treatments but also lifestyle choices, nutritional support, and emotional well-being. By taking a more holistic view, we can better support women in achieving and maintaining optimal health. Ultimately, the story of the contraceptive pill is not just about hormones and health. It is about power, autonomy, and the evolving relationship between science and society. As we move forward, it is essential to continue asking difficult questions and challenging assumptions. Are we truly empowering women by offering them a choice among hormonal interventions? Or are we perpetuating a system that prioritizes convenience and control over long-term well-being? The answers to these questions will shape the future of women's health and determine how we approach the next generation of innovations. Whether through advances in bioidentical hormones, improvements in conventional therapies, or a shift toward more integrative care models, the goal must be to support women in making informed decisions that align with their unique needs and values. Only then can we ensure that the legacy of the contraceptive pill is one of empowerment, not just in the realm of reproduction, but in all aspects of health and life. If you found this video eye-opening, please give it a thumbs up and share it with someone who might benefit from understanding the deeper story behind the pill. Don't forget to hit that subscribe button so you never miss out on more in-depth content like this. Thanks for watching.